I was really looking forward to hanging with you. So I'm glad we got this going.
Same here, likewise. So thrilled to be here. Super excited.
I know, I
Thank
know.
you.
And
Thank you for having
well,
me here.
I love the energy. I loved your background, and I know it's going to be a great show. So, what we always try to do, and I know it's a little bit of a repeat, but we'd love to start with empathy because all of our community are data scientists, data enthusiasts, but we're humans. And we all, no matter what age, sex, or nationality, we all dealt with self isolation during COVID. It's the one time we all can look at something and say, wow, we experienced something together. And I love to get a sense of your mental health hacks that helped you survive and thrive last year. And I mean, and this sets you up perfectly for what you're doing, even at your day-to-day job. I mean, you're right in the middle of it. So teach, preach, and share. How did you do it?
Absolutely. Well, 2020 was a very, very adventurous year.
Oh, yeah. Oh, yeah.
I mean, even at the personal level, because I got married last year. So that was something.
Hold on. You got married. Was it a Zoom marriage or did you get it in before the quarantine?
I got there before the quarantine. So actually, that's
That's
very,
great.
very interesting story because I'm originally from India. So I was traveling to India for my marriage, and then I traveled in March.
Okay.
And immediately after that, everything just closed down. Like it was like complete shutdown. So our marriage was postponed, but eventually it happened. But other than that, I mean, it was very adventurous. Some of my close family members, they got COVID as well. So it was very tough in that sense.
Oh,
Yeah, but other than that, just being with my family for like 10 months, like my mom and dad it was like a blessing because I never thought that I would be able to spend such a long time with my family back in India. So personally, on personal level, it was very good opportunity to just be with them for all that time. But of course, like all those news that we were hearing every now and then from parts of the country was very disappointing and very like shocking. But then just being with my loved ones, with the family, just gave all that support. I think that was very important at that time. So
well, I think you bring up something I've talked about with on the show and with friends. When we look back at this time, and you just delighted me by saying you spent time with family. We look back at this time, and I've reflected on this. I'd love to get your thoughts. Most of the time you spend this much time with your family, it's you're going in because of a tragedy, like
yeah,
someone's sick, and you're uprooting your schedule, right? You have to leave in 24 hours or leave in 10 days. And I too was able to spend such a great amount of time with my family when people were healthy. I mean, COVID is still a thing, but like other health issues, it was nice. And I'm so happy you said that because I said to them, we're going to look back on this time and almost wish we had a little bit more time of isolation because I'm going to miss it.
I totally agree with you, Darren. I mean, that was something that actually really, I mean, that support was what we needed all that at that time. And then I had that. I feel like very fortunate having that time with them.
And I think the next thing that this also I think about on these opening few minutes, it's just most of America have vacation days, meaning you have to work a few months to accrue a day, then accrue another day. In Silicon Valley, where I'm from, you have unlimited vacation days. So again, going to see your family, that means you have to wait and save up those vacation days. And now with COVID, you got the work done. You can go away for 4 weeks.
Exactly.
And get the work done. It's like, I almost hope the HR policies are changed because of this. Why have to accrue a day? I know there's other tax and other reasons. What are your thoughts on that?
No, absolutely. I mean, we are like a growing company at this point, and then very quickly we had to come up with like a teleworker policies, all those things that like we would want to have to support all the members, like all the colleagues and all the employees of the company. So that was something we very quickly did, and everyone was like in different parts of the world, but like helping others to like adjust to their schedules because I personally was I mean, like I said, I was in India. That's almost like 10.5 hours ahead of Eastern Standard Time. Like, so that support that I got from colleagues and all the leadership in the company, that was very, very helpful.
I love it. I love it.
There were some times that some meetings that you have to attend, but other than that, being as flexible was very helpful. I think those things. And then also internally, we even launched like a mindfulness session, which was called like 21 microdoses of mindfulness, which were like very short videos you get every week from a health expert. And that was sent out to all the employees and even other members of the community to just understand the importance of like compassion, gratitude, all those things at the time, which was very required, I think. So all those things helped us a lot.
You get 5 stars for sending out those those micro videos. No one has brought that up. Everyone has been doing happy hours and those type of things, and that's not good or bad. I've yet to hear anyone that has really upped it to say,
did that too,
yeah, why don't we just make things really easy, because you're not going to search for it. We've already searched for it. We've already vetted it. Just watch this. I love that. Tell me about that. It's amazing.
Yeah, basically it was like small short videos sent out every week talking about simple things in life that you should be mindful about, rather than focusing on everything else, which is noise. It's focusing on every small thing that helps you, like even like when you're standing under the shower, just feeling that water. Those are small things that we always ignore, but just being mindful about everything that we feel, we sense, it just gives you like eternal connection to everything around you, like creates a stronger bond, and it creates like a mental relief, I think. That's what I've felt personally.
You fit right into our community. The reason why I built this community was I was lonely, needed hugs. And we can sit here and you and I can talk about data and data models and regressions. But to me, this is a more interesting conversation that all our fellow data scientists went through. We're all a little bit more introverted, but we're all human. So I really appreciate you sharing some of that stuff with me. I guess a delayed honeymoon, is that fair?
Yeah, like super delayed actually.
And is it wrong for me to ask, are you still married?
Oh my God. Yeah. I'm still married.
Okay.
Happily.
You know, that because you got married self-isolation. It would be a bad story if you're like, yeah, like self-isolation. Like we realized like we're not meant to be.
Actually, that helped us like grow a stronger bond, just being together all the time, and then just adjust.
I love it.
Each other. I mean, it was nice. It was nice.
I love it. Now that, COVID, there's vaccines happening. I don't know. Are you going to look to staff differently moving forward? Do you see how you're thinking about hiring? Because you said you're expanding. How are you thinking about the teams and how are you thinking about hiring moving forward?
Yeah, so I mean, right now we are not that much looking into like in-person offices or things like that. But I think in future, depending on the objectives in terms of the client locations, and I think most of our clients are around New York City area, and we have other clients in other parts of the world as well. But most of us are here in New York City, and then we have some clients here. So I think moving forward, we would have some sort of office. So there is a part of the staff that we would need there. So that would always be there, and we'll be looking to expand that part as well. But other than that, some jobs like IT jobs and other marketing, those still can be handled remotely. So I think it'll be like a mix. So it'll be like adapting to the requirements of people in remote jobs. So it will be mixed, definitely. It'll be growth in both the directions, I think.
Sorry, I agree. You got to be flexible.
Exactly.
So I agree with that. I have now heard about a lot of companies hiring from different locations and regions, and it's really nice to hear how now people in cities that might have never been offered an opportunity at a great company are now getting these great opportunities. So to me, this is another win of COVID.
Absolutely.
Like it's great. And I think diversity numbers will follow.
Exactly. That is for sure.
Now, anything else you want to share? It sounds like you're seeing a lot of stuff in your sector. Anything else you want to share or promote on the podcast?
Yeah, I mean, I was interested in talking about just digital health. I mean, the company, the journey of how we have come this far in terms of the platform that we have and then other features.
Yeah, let's talk about it. Go for it. Let's hear it.
Absolutely. Yeah. So, I mean, digital health, we have been hearing that word so often. And I think especially after COVID, where everything went digital health also like picked up that pace. And we were like seeing a lot of digital health, like the term itself everywhere in the news, like going into the telehealth visits. I mean, of course, you couldn't visit a doctor, so there were a lot of telehealth visits. And I think the digital health topic itself is definitely on the next big thing, I think. And then at least in the healthcare. And I think the opportunity that came along with it was something that helped us as well grow. And because of that, I mean, we also reached out to 2 million people in New York last year, just to basically send them text messages, just to feel about how they're feeling about themselves. Are they close to someone? Have they been exposed to COVID? Things like that. So basically just tracking people and then managing that population and creating like a data analysis on top of it, like which locations in New York City have most of the cases reported. So all those things, usually you get that data from hospitals, but we were able to get that data from the population itself, the people from New York itself. So that was something which we did recently. So that was all possible because of the digital health assets that we have into the platform. And in terms of platform itself, so I'll just briefly talk about the journey of RX Health. And RX Health is a digital health SaaS platform. We create and automate digital health assets and then unify them and then basically bring that back into the health system to just improve their workflow. make it more efficient. And it's baked right within the EMR. So physicians don't have to basically exit from what they are always like used to working with, which is like the electronic health system, because there's a lot of things they are dealing with when they're looking at the patient. So we want that, and they don't really like to switch between systems. So what really stands us apart is that we are very easily able to integrate within the health system and reduce physician burnout, and basically help them to see all those assets that we have into the platform. And by assets, I mean all the digital assets that we have into our platform, which is all the curated apps, digital health apps, and then also the self-created care plans for the patient to help them prepare for a procedure. And these care plans, they span a period of time. For example, if a patient has an appointment in 10 days, he would get regular appointments about his or her schedule. He will get appointments about the medicines that he needs to take. He'll get parking directions. He'll also get health education material. So all these different small assets, we combine together, and then that's what goes to the patient. And during that journey that patient gets, he's able to engage with the pathway, and we are able to get that engagement data, and that data is then reported back to the physician after it goes through the different sets of data analytics and data science and data machine learning algorithms to basically analyze if there's any pattern in the patient, or if the patient falls into a high risk category or a medium risk category or a low risk category. So all those things we're able to do with the help of the engagement data and also the other medical data for that patient. So I think the access to all the data when we are within the EHR, and then also data directly from the patient, is what helps us to uniquely identify a patient's particular need. And that's where we are able to exactly spot on support the patient, and also support the physician in determining which patients need more help as compared to others, so that they can be reaching out to patient that if they need help or not. So those things are.
Oh my God, talk about good timing. I mean, you could not have started or been at a company doing that solution at a better time.
Absolutely, yeah.
I mean, that's incredible. And there are a lot of great people in our community that are in the space that you're in. So if it's okay with you, I'd like to connect you with a few people, both in that sector, just working on interesting data sets. It's like there is a lot of good things going on there, and there's a lot of people I'd love for you to meet, if that's okay with you.
That's absolutely fine. And I'm personally looking forward to meet people all the time. So
yeah, no, that's wonderful. And I think some of them also are working on similar problems, maybe similar stages. So you're right, the shared learnings and the empathy is the win, right? So it's great to connect you with data scientists, but I'm also happy to connect with these data scientists who are empathetic, who would lead with empathy. You're going to have just such more meaningful conversations. So yeah. I really appreciate you taking the time to share your story. Congratulations again on being married and a newlywed and happily married. I love the problem that you're solving, and boy, oh boy, what a time
Absolutely.
to be in this space. So I'll make some connections, and thank you for being on the show. We are the Data Standard. We're sponsored by Pandio, and we're so grateful for their support. I'm pumped that we were able to get on the calendars and do this. So this was fun.
Absolutely. Same here, Darren. Really looking forward to further interacting and then speaking with the community. Absolutely.
Yeah, we're going to be hanging out for a long time. So this will be fun. All right. Thank you.
All right. Thanks, Darren.